In this country, 2 million people will be burned this year. How well each will survive, whether each will survive at all, can depend on what you do in the first minutes of a burn emergency. The first responder to a burn emergency may be a police officer, firefighter, ambulance team, co-worker, or maybe a bystander. Whoever it is, they need and you need to know what to do in case of burning. A burn is the injury or destruction of tissue by heat. Burning begins when tissue is heated to 113 degrees Fahrenheit, 45 degrees Celsius. The heat can come from flame, hot water, or steam. It can come from hot objects, electricity, or chemicals. Burns are defined by source of heat and by how deep into the skin the heat is reached. Here, a makeup artist simulates the 3 degrees of burns. First degree burn. Only the surface of the skin burned. Skin looks reddened, like bad sunburn. Second degree burn. The burn is deeper. Skin is discolored or blistered, often with wet or weeping surface, and is painful. First and second degree burns affect only part of the thickness of the skin and are called partial thickness burns. Third degree burns affect the entire thickness of the skin and are called full thickness burns. In third degree or full thickness burns, the skin appears white, charred, or leathery. It may be surrounded by second degree burns, and the nerves have been destroyed along with the skin, so there is no pain. The skin is our first barrier of defense. Skin keeps germs out, fluids in. But burns attack the skin and result in loss of fluids and shock. Later there will be infection, and full thickness burns will cause permanent tissue loss, permanent scarring, which can be physically and emotionally crippling. Also, burn emergencies may involve smoke or chemical fumes. These can cause inhalation injury and poisoning.
Out.
Small partial thickness burns are easy to care for. Cool the burned area under water until pain diminishes. And cover with bandage or cloth. Ointments are not necessary. The body will heal itself. But serious burning requires fast and careful action. Here are 3 B's and 3 C's to remember and use in case of burn emergency. First B, burning stopped. Remove victim from heat, heat from victim. Put out any fire on victim. Don't let the burn get worse. Second B, breathing maintained. Open airway. Give oxygen or artificial respiration as needed. Remember, most burn deaths are actually from inhalation of smoke or fumes. Third B, body examined. Look for problems of heartbeat, bleeding, shock, or fracture. Estimate seriousness of burn. But remember, while the burn may look bad, there may be other problems of more immediate danger. Always treat the worst injury first. When time to treat the burn, follow the 3 C's. First C, cool. Cool burn with water. Also cool by removing hot clothes and jewelry. Anything that could hold heat in. Second C, cover. Cover burn loosely with clean sheet or cloth. Any fast, simple dressing will do. Third C, carry. Carry victim to emergency room as soon as possible. Remember, you cannot stabilize a burn victim in the field. 3 B's and 3 C's. Breathing maintained, body examined. Then cool, cover, and carry. Here's how this system works in a thermal burn emergency. First priority is to stop the burn from getting worse. Remove the victim from the heat, and the heat from the victim, until burning has been stopped. Next, check breathing of victim and support it. Tilt head to give an open airway.
Okay, easy down. You got him.
Check for obstructions and remove them. Assume there is inhalation injury, especially if victim has been burned in a closed space, or has burns of the face, or has a cough, hoarseness, or soot in the airway. Maintain breathing, and remember, there can be inhalation problems even though there are no visible burns at all. Next, make a fast examination of victim's overall condition.
Bleeding here from his right ankle.
Looks like he has a compound fracture here, John.
Assess the burn at the same time.
Hello, this is Mission Emergency, Dr. Verrier.
Sustained approximately 18% burns, face, both sides, the thumb.
If needed, and treatment personnel are qualified, get permission to start an intravenous line.
Start D5 lactated ringers. And keep it running at about 200 cc's.
Cool the burn with water. Remove anything which could hold in heat, including jewelry. Trim around anything which sticks. Cover burn as quickly and simply as possible. Use a sheet, blanket, t-shirt, anything to protect the burn until arrival at the emergency room. And start transportation to the emergency room as soon as possible. Move victim gently to prevent further trauma to burned areas. And don't forget to bring along all burned clothing. Place the victim on his side during transport, so he will have a clear airway if he vomits. At the emergency room, give quick accident and treatment reports to staff.
paint fell off the ladder and hit the respiratory caused an explosion. There was quite a bit of smoke in the room.
Hand over burn clothing for later analysis. And stay at the emergency room as long as you are needed.
This is the man that's out, got a fractured femur.
Fractured tibia, compound fracture.
Okay, how's your breathing? Take nice, slow, deep breaths, okay?
Another kind of burn that goes to the emergency room is any electrical burn.
Control 120. We have a victim of electrical shock at 1519 McGee Street, ambulance code 3.
In electrical burns, there may be cardiac arrest and burns from arcing electricity or clothing set afire. First priority is always to remove victim from the source of electricity. Try to turn off the electricity. Not possible? Use wood or other insulated material to move the electricity away from the victim. Doesn't work? Move the victim, but not with your own hands. Use the insulated material to protect you against the electricity and to pull the victim clear.
You all right?
Then immediately check airway and circulation. If there has been a cardiac arrest, start CPR, cardiopulmonary resuscitation, at once. The victim sometimes responds quickly. Next, support breathing with oxygen and look for other injuries, bleeding, head wounds, or fractures that may have resulted from falling.
She might be burnt on her hands.
The greatest danger in electrical burns is internal burning. An electrical burn is like a bullet injury. There's an entrance wound where the electricity went in. There's the path the electricity took through the inside of the body, burning as it went. And there is an exit wound where the electricity left. Internal burns cannot be seen or treated at the accident site, so electrical burn victims should be carried to the emergency room as soon as safely possible. Yet another source of burns are chemicals. Strong chemicals can cause rapid and severe burning. When chemical burns occur, immediately get the victim to water and begin to flush chemicals off skin. And don't skimp on the water. Then remove anything that will hold chemicals against skin or eyes. Clothing, shoes and socks, jewelry, contact lenses, all off as fast as possible. And keep the water flowing. Next, look for other emergency problems, such as bleeding, and treat them while continuing to flush the skin with water. Some chemicals will react dangerously to water. If you work with such chemicals, be sure to know what to do in case of burn. But in most cases, it is water you want, and lots of it, until a doctor says to stop. Chemical burns are especially serious when the eye itself is burned. Begin flushing the eye as soon as possible. Carry the victim to the emergency room as soon as possible after that. Continue to flush the eye during transport. So far, we've given you things you do for care of burns. Now here are things you don't do in a burn emergency. Don't put anything on a burn that will keep heat from getting out. No ointments, nothing oily, no butter, no Vaseline, no vitamin E. The only thing to apply is water or some other liquid to cool the burn. Don't overcool the victim. Cool burned area only until skin temperature is back to normal. This rarely takes more than a few minutes. And if victim begins to shiver, stop all cooling activity. Don't give anything by mouth to serious burn victims. No aspirin, no medication which has to be swallowed, no stimulants, alcohol, or even water. Anything swallowed could be vomited up and inhaled, so nothing by mouth. Don't break blisters or remove dead skin. These still protect the body against infection. Don't remove anything that sticks to burn. If clothing sticks, for example, trim around it. Don't leave burn victim unattended. If you have to go a long distance or long time for help, take the victim with you. Don't delay transport of the seriously burned. If breathing and heartbeat are stable and fractures are immobilized, load and go. The victim needs to be at the emergency room as fast as safely possible, because you cannot stabilize a burn victim in the field. In choosing the speed and order of emergency treatment, the question is always, how serious is the burn? Burns are usually rated by size, by the percentage of body area burned. And this is estimated with the rule of nines. In the rule of nines, the adult body is divided up into surface areas of 9 and 18%. The head and neck is 9% of the body. Each arm, 9%. Each leg, 18%. The front of the trunk of the body, 18%. The back of the trunk of the body, 18%. And the genital area, 1%. A burn is usually serious when 10% or more of the body's surface has been burned. But smaller burns can be serious if they are on the hands, feet, face, or genitals. And almost any second or third degree burn can be dangerous if the victim is very young, very old, or already sick. In summary, we have seen that a burn occurs when tissue is injured or destroyed by heat. Burns are defined by depth of skin affected, with first and second degrees being partial thickness burns, and third degree being full thickness burns. Inhalation injuries can also occur in burn emergencies. Inhalation of smoke or fumes should be treated immediately. Maintain an open airway and give oxygen. With electrical burns, there may be breathing stopped or cardiac arrest. Another danger is internal burning. Internal burning is not visible or treatable in the field, and the victim should go to the emergency room as soon as possible. Chemical burns are usually treated by flushing with water. Clothing should be removed and flushing continued until doctors advise otherwise. Remember and use the 3 B's and 3 C's. First B, burning stopped. Second B, breathing maintained. Third B, body examined. And then cool, cover, and carry. Carry the victim to the emergency room as soon as it is safely possible.
One down this way to trauma room 3.
Got burns on both. Left side.